In Dallas, one of the world's most vibrant and wealthy cities, we expect our children to be healthy and thriving. But harsh statistics tell us a story that's not reflected in our gleaming skyline. When it comes to our children's health, we're facing a generational moment of truth, the tragic potential loss of a productive, healthy future for our city. The truth is that for many of our children, their health and well-being is not good, and it's getting worse. 29% of our kids live in poverty, 18% don't have health insurance, 28% have inadequate food and nutrition, 35% live in a single-parent home. For any one organization, the challenge is too great, and for the entire community, the status quo is not acceptable. Take a look at one family, a single mother whose son has asthma. She doesn't have health insurance, so she can't take her son to regular checkups, and she can't pay for asthma medications. When her son has an asthma attack, she has to take him to the most expensive place to get care, the emergency room. They stay in the ER late into the night, making them both too tired to perform well at school and work. To prevent asthma attacks, the mother tells her son not to run or ride his bike, not to exert himself at all. Otherwise, she fears they'll be back in the ER. The boy feels different than other kids and has trouble making friends. His grades suffer because he's always tired. He gains weight because he doesn't get much exercise. How can he be expected to reach his full potential? Thousands of Dallas kids live like this, which has long-term consequences on their health and well-being and the city's future. But we can change this. And the Health and Wellness Alliance for Children is taking bold steps to do so. What is the Alliance? Established by Children's Medical Center, we are a coalition of passionate community members determined to improve the health and well-being of all children. We are you, viewed from the lens of the community we serve, and guided by the voice of our at-risk children and their families. Our goal is to organize and engage our community in a collective impact initiative that will bend trends and improve the overall health and well-being of all children. Together, we are the voice of at-risk children and their families. We are nonprofit and social services, hospitals and clinical care providers, government, business, and donors. Many nonprofit groups do great work in specific areas, but the Alliance is uniquely focused on the integrated, community-rooted nature of health, housing, education, safety, food, and financial security. We involve participants across many different sectors and have a clearly defined common agenda. If this sounds ambitious, it is. That's why we're starting with one priority: childhood asthma. More than 60,000 children in Dallas, enough to fill the American Airlines Center 3 times, suffer from this chronic illness. Annual economic costs to Dallas, including costs to families and to medical care facilities, is estimated to be $60 million. There are many childhood health issues that demand our attention, but to make measurable progress, we're focusing initially on mitigating the negative impact of asthma on our children and our city. We'll use our experience with asthma to expand to other areas soon. The challenge is immense, but together, we are up to the task. We will improve the well-being of our children.